First degree heart block. First degree atrioventricular block or first degree heart block is defined as prolongation of the PR interval on electrocardiogram to more than 200 milliseconds. So before understanding the first degree heart block, we have to understand the electrical pathway of the heart. So this is the heart, and this is SA node, and this is AV node. So the electrical impulse is being generated in the SA node and it travels through the AV node. Then from the AV node is transferred to the bundle of his, then to the left bundle branch, to the right bundle branch, and to the Purkinje fibers. This is how the electrical pathway like starts from SA nodes, and after starting from the SA nodes, it distributed to in the atria, and after that the depolarization or the contraction, due to the depolarization the contraction of the atria occur, and after that there is an AV nodal delay in the AV node. After that the impulse is being transferred from the AV node to the bundle of his, then to the left and right bundle branch, and then to the Purkinje fibers. This is how after the after this the ventricle contracts. There is a problem in the pathway, as you can see here. The problem is here, the SA node generates an impulse, and the impulse is being transferred through the electrical pathway to the AV node, but there is a problem in the pathway that is due to the fibrosis or nodules or sarcoidosis. But that's the reason of the delay of the impulse through this pathway that caused the prolongation of the PR interval on ECG. So that's the reason, the normal PR interval, as you can see, the PR interval denotes the AV node, atrioventricular node conduction, and the duration is 120 to 200 milliseconds, that is equals to the 3 to 5 small squares. But in the case of first degree heart block, there is a prolongation, of the PR interval more than that is 200 milliseconds. So the physiological is till 120 to 200, but if it is more than 200 milliseconds, that can be the reason of the first degree heart block. So in physiologically, in the normal person, if the sympathetic system is being activated or it's being the physical activity doing, then the person can have the PR interval less, because PR interval is inversely proportional to the heart rate. So if the heart rate increase, then the PR interval decrease, and same is the opposite. So in the normal people, the PR interval can be changeable. So if the person has having sympathetic activity, the PR interval decreases. If the person has having the vagal tone high, the person can have uh, uh, more PR interval. That is the prolongation of the PR interval can be also physiological. But in this case, in first degree heart block, there is a pathology between in the pathway that cause the prolongation of the PR interval. The etiology of the first degree heart block can be due to the enhanced vagal tone that can cause the PR interval to prolong, and can be also in the acute myocardial infarction, particularly in the inferior wall, myocarditis, and electrolyte imbalance can cause the prolongation of the PR interval. Some drugs can also cause, and the athletes, due to the high vagal tone, can also be having the prolongation of the PR interval. But in this, the athletes are having the physiological, and with the pathological is rheumatic fever, hemochromatosis, sarcoidosis, endomyocardial fibroelastosis can cause the first degree heart block. So in the first degree AV block, we see the prolongation of the PR interval. So the normal PR interval consists of 120 to 200 milliseconds, that is equals to 3 to 5 small box. So the prolongation is in the first degree AV block, there is more than 200 milliseconds. So there is a prolongation of the PR interval in the first degree AV block. So as we can see, there is a prolongation till from here till here. As if we measure the boxes, the small boxes 1 2 3 4 5 6 7 8 9 10. So there is around 9 to 10 uh, small boxes in the PR interval that cause that shows there is a prolongation of the PR interval in the first degree AV block. So in the first degree AV block, there is a delay of PR interval of more than 200 milliseconds. Uh, the patient does not have any symptoms, and the treatment required depending upon the pathology that the patient is having. That usually are the electrolyte imbalance. We treat the imbalance, and or the medication, due to the medication we treat the medication or change the medication, and there is no usually treatment for this. Thank you.